Hello and welcome to Talking General Practice, the podcast from GP Online. I'm Emma Bauer, the editor of GP Online. Today on the podcast, I'm speaking to Dr. Emma Ryan, who's a GP in South East London and the Royal College of GP's clinical champion for gambling harms. In this conversation, we're talking about the role general practice can play in tackling problem gambling and gambling harms. Emma explains the impact problem gambling can have on individuals and their families, recommendations from NICE's new guidance on gambling, and why GPs should ask patients about their gambling habits. She also talks about all the support that's out there available for patients, a new educational resource that she's developed for the RCGP, and what support practices themselves can provide. I'm delighted to be joined on the podcast now by Dr. Emma Ryan, who's a GP in South East London and the Royal College of GP's clinical champion for gambling harms. Emma is part of the team that established the Primary Care Gambling Service and is the co-author of a Primary Care Gambling Competency Framework, which is endorsed by the RCGP. She's also developed the RCGP's Gambling Learning Hub and is a member of the committee for NICE's guidance on gambling. Thanks for coming on the podcast, Emma.
Thank you for having me.
I've done a roundup of all of your work and stuff around gambling. So how is it that you got interested in gambling and gambling harms?
So I first got involved in this area in 2019 when Dame Claire Gerarda recognised that there was an unmet need for patients with gambling harm, specifically in primary care. And she felt that GPs were ideally placed to help patients, as we are at the front door of the NHS and we have over 1 million consultations a day. So we set up a plan with two aims, and one was to set up a GP-led treatment service, and the other was an education program to raise awareness of gambling harms, specifically among the primary care workforce.
And this is the Primary Care Gambling Service?
Yeah, so I'm the clinical lead for the Primary Care Gambling Service, which is a GP-led service, the first of its kind. It's national, and it focuses on looking after patients with gambling harms. We set this back up in 2019. And if you imagine, we had 0 patients and we sat there and we did some education locally in South East London with GP practices. And by raising awareness, we slowly started getting referrals in, and it's just grown from there. It's grown out of South East London. It's now a national service, and we're very much part of the system with the other providers that already exist there now. Historically, 90% of gambling support and treatment has been given by the voluntary sector, and that's all over the country. And more recently, there's been some specific funding that has gone to the NHS, which has also allowed them to provide clinics in secondary care to provide support and treatment.
What do we know about the prevalence of problem gambling? I mean, is this something that's getting worse? Obviously, there's been a massive explosion in online gambling in recent years, so it is much easier for people to have access to gambling. But what's the sort of prevalence of it as a problem?
So what we know, and it's difficult to get a real-time prevalence, but we know from surveys that are carried out by the Gambling Commission that an estimated 340,000 people are thought to have a gambling disorder in the UK, with another 2 million experiencing some harm, also at risk of developing a gambling disorder. And this is the most important thing, though. Out of all those people, we are getting less than 5% into treatment. So this is why we're trying to talk about it and raise awareness around it, so that healthcare professionals, A, can consider it in consultations, but also know that there is lots and lots of help out there, but we need to get individuals into the help that is there. So you're absolutely right as well about it increasing. So basically that has been a result of the internet and all of us having smartphones. So we can now gamble 24 hours a day, 7 days a week. So previously, and even when I started getting into this space back in 2019, you would think of someone gambling as a man outside a land-based betting shop that's going to place a bet on the dogs or the horses. But actually, everyone, including a lot more women now, can gamble on their smartphones from the comfort of their home or from bed or at work, unfortunately, as well.
Are there any groups of patients that are particularly more likely to be affected by problem gambling, or is it just very broad now, like you said there?
So it is important to consider it in terms of anyone can get affected. And we see that in those that come through our clinic. But there is evidence, and we also see that in our data, that young men are increasingly at risk. And we know that when we do the assessments, it's often young men that are betting on football. So they're betting on sports. And one of the questions we ask in our initial assessment is, did you have a big win? Because the evidence is that if you're in a group of friends and you're the one that had that big win on the first time people were going out on a day out, say to the horses, recreationally, that person will then go on to continue gambling in some cases and come to more harm. So young men, again, university students that get freedom from their parents, because also with gambling, it's about having time to do it as well. So people think it's all about money, but it's also the amount of time you lose being focused on your phone or your laptop. Increasingly women, because they're often getting involved in online bingo, online Facebook raffles, which draws them in because it's again thought of as recreational and I'm making friends, but actually it can turn sinister quite quickly where you can win a raffle but you can't get your money out unless you put more money in. So there's lots of things going on which is affecting the whole scope of the population. In terms of talking about my background as a GP as well, you would specifically think about it in those patients that present with mental health, so depression, anxiety, stress. You would also think about it in patients who have Parkinson's disease. So we know that patients with Parkinson's disease are 7 times more likely to develop a gambling problem compared to the rest of the population. That's without being on medication, because what we also know is that the medication that's used to treat Parkinson's disease, the dopamine agonists, also increase the risk of people gambling. So it's always important to think about that when you see patients with Parkinson's disease. I suppose the other thing to just have in the back of the mind is careers where people have time, which I mentioned before. So sports people who may train in the morning and then be in a hotel in the afternoon and have nothing to do. We see it in people that are placed overseas for the military. Again, they have time. People who've grown up with gambling, so they've grown up maybe in a horse racing family. Some people, when you interview them, they've grown up in a gambling shop. You know, they lived above a gambling shop or one of their parents ran a gambling shop. So again, it's exposure. If people have been exposed to it, it becomes their norm and socially acceptable.
Lots of people, when they think about gambling, they probably think, oh, it's just a little flutter here and there. But obviously, you know, it does spill over into some quite serious problems for people. So what sort of impact does problems with gambling have on individuals and their families? I mean, what's the health impact of it, I suppose?
It can affect your mental health, it can affect your physical health, and it can affect the social aspect of the way you live. So often patients, because they are so stressed when they finally come for help because they haven't been identified before, are suffering with mental health issues, so depression, extreme anxiety and stress because they've got a lot of debt or they're about to lose their house. So mental illness is really up there. Also, some patients, though, because when they come to the GP, they don't think, oh, this GP doesn't know anything about gambling. So they present in a slightly different way. They may present with insomnia or high blood pressure or ulcer symptoms or just general, oh, I just don't feel right, I've got body aches, non-specific symptoms. So we've also got to think about why people are feeling like this when they present like this. The impact on the person's life. So they're spending money all the time they can't afford, they can't stop themselves gambling, and they can't think of anything else apart from gambling or do any other activities or go out with their family or speak to people at work. So it does affect the people around them. Those people around them experience harm as well, which is on an equal level to the actual person they are living with that's gambling, because they have the debt, the risk of losing their home. The phrase that's often used for this group is affected others. That's being looked at now because it's kind of got a negative connotation, but the affected others are family, it could be colleagues at work. So if you're in a team that needs to get a deadline and you're with a colleague that stayed up all night gambling and then doesn't turn up the next day and hand in a certain project, the whole team lose that benefit. So it's also looking at the people around the person gambling, and that can be family, it can be colleagues, it can be communities. So we know also that there's certain cultures where it's really associated with shame and stigma, and actually that family would lose their kind of standing in community events and work opportunities if it comes out that they have someone who's gambling in their family. So it really does affect health, resources, and it has a real cost to society as well.
I mentioned at the start that you have been involved in the NICE's guidance on gambling. So this is the first time that NICE has looked at gambling and gambling harms as an issue. And the final version of that guidance is due to be published imminently. So one of the things it says is that GPs should be routinely asking patients about their gambling in the same way that they ask about smoking and alcohol use. What exactly does the guidance say, and why is it saying that?
It's going back to the beginning that we know there's people experiencing harm out there in society, but the problem is they don't know that we have the skills to help them. So they don't see the GP as a place to come for help. And when they do come for help, the GP themselves doesn't know what to do because they've got their own kind of unconscious bias about gambling. They see it as a recreational thing. They don't see it as a medical problem. They don't see it as a behavioural addiction. So what the NICE guideline is saying, look, the more people in every aspect of public sector life, whether you're a GP, whether you're working in prison services, whether you're working for the police, that is educated on gambling harm, the more people will be identified and put into treatment. Now, I'm a GP, and sometimes it can feel that every problem gets dumped on GPs, like you're the one that's got to pick this up, whatever the subject is. So what we're saying in the NICE guideline is very simple. You don't have to do much, but when you are in a consultation with someone with the physical complaints I just mentioned, so insomnia, indigestion, high blood pressure, or obvious mental health symptoms, just think about gambling. And when you think about gambling, ask about it, because that will mean that someone will think, oh, maybe I can open up to this GP because they've just asked me the right question at the right time. We spent a long time on the NICE guidelines talking about what the question should be. And actually, I was really passionate that there should not be a definite question, because then people won't ask it because they're going to think they're asking it in the wrong way, and that will be a block. So it's just to ask, you're in debt, is that because of gambling? Or it could be, oh, are you worried about someone close to you gambling? It's just ask the question like you would, ask your mum or one of your children. It's not going to be any scientific question. It's just to let that person in the room with you know that you're thinking about it. So that's what all it is in the NICE guidelines, but it's part of a whole system approach that everybody, whatever sector you work in, is asking.
One of the things that GPs might be concerned about when it comes to discussing this issue is whether there's then any support. So GPs might identify these people, but then what do they do with them? I mean, there are specialist NHS services, and we've mentioned the primary care gambling service, but they're quite few and far between, aren't they? How easy is it for people to access these sorts of services?
So it's a really exciting time at the moment because we have the NICE guidelines, which are really going to help raise awareness in this area. And at the same time, we actually do have a lot of treatment and support services out there, but we've just got to connect people to them. In terms of what there is at the moment, I think I mentioned that a huge amount is being done in the voluntary sector. And these are charities that often have people who've experienced gambling themselves involved in them. And they're in an ideal place to go out into local communities and reach out to people to bring them in for support and treatment. Because the other thing we've got to remember is that we need to give patient choice. So not every person who's gambling wants to go to the GP or wants to go to an NHS clinic because they're going through this cycle of feeling guilty and shame and stigma, and they don't want that on their medical notes. So it's kind of fourfold that what is out there. So there's the voluntary sector, which is very much in local communities, and they're all different providers across the whole of the UK. Then you have us, which is the primary care gambling service, which is national, and we're very good at looking at a patient holistically. So often many of our referrals from the third sector will be those patients that have complex health needs as well as gambling, so that we can unpick it all. Because what we know is that if we help with, say, uncontrolled diabetes or insomnia or pain, that helps them feel strong enough to deal with the gambling. And then there's 15 clinics now they've opened. They were part of the NHS long-term plan to be opened by 2024. And so nearly every region across the UK also has an NHS secondary care clinic. And what is going on at the moment is working out how all these parts fit together to work seamlessly as a system, so that wherever you reach out for help, you end up receiving care, support and treatment at the right level for you. Whether you just need early intervention, you just need a little bit of motivational interviewing and a bit of support and you get better, or whether we need to come and have a look at your health, or whether you have associated mental illness and you may need to go to a secondary care setting as well.
So the primary care service, is that mostly GPs who work in that?
Yeah, so we're GP-led, so we're GPs that set it up, and then we've set up a multidisciplinary team. So we have GPs, mental health nurses, consultant psychiatrists, care coordinators, and then numerous admin staff. Because when we started out, we have experience as GPs in pathways, budgets, mental health. We had to learn about gambling and recognize it as a behavioral addiction, because when you go through medical school, or when I did my Royal College exams, or even if you speak to psychiatrists, it's never really been in the curriculum at all. So we had to really think about what was going to come through the door. Claire Gerarda said to us, look, just love these people, be there for them, love them, the rest will fall into place. And so I can't stress enough the importance of care coordinators as well. So if someone doesn't answer the phone, say for my assessment, I have a care coordinator that will track that person down for me and put them back on the phone to me, because people wax and wane. You have bad days, we all do. So we don't want to lose them to therapy. We have to really reach out and pull them back in. So we really work hard to retain patients that have reached out for us.
So in terms of options for treatment and therapy, what therapies and treatments do we use in these patients?
So it is a behavioural addiction. So the mainstay of treatment, which will be published in the NICE guidelines, is cognitive behavioural therapy. You normally need, we think, 8, maybe up to 12 sessions with a therapist in that area. So that's the mainstay. So if you're doing an exam, you would say cognitive behavioural therapy. Often, though, when we do assessments, there are trends in the assessments. Because we've started with 0 patients and we're now up to number 1,000, we have an enormous amount of data about who's coming through and what have happened to these people, which has led them to gamble or always contributing to gambling. And we can see that lots of people have childhood trauma. So they've had some kind of adverse childhood event. And the more adverse childhood events you have, the more likely you are to gamble. So we have there's evidence on that outside of our assessments, but we can see that's true in our assessments. So often if there is a lot of childhood trauma, we would go for psychotherapy, which is a much longer course, so 20 sessions. It will be over almost a year, really pinpointing why people go to gambling when they have stress in their life or feel anxious. There are some people that have literally gambled for 30 years of their life, 40 years of their life, and they've been through CBT before, which is trying to get you to manage the urges, trying to get you to think about your behavior and what you can do instead. And that doesn't work. So it's another arm. So CBT, psychotherapy, And then all the holistic stuff. So the care coordinator stuff I've mentioned, having mentors, having people that have been through it before, so lived experience, colleagues that can really go, look, I was there and now I'm better. I can't stress enough how important they are. So the aftercare is really important, where we use people who've actually experienced gambling harm before, so that we can just keep maintaining the abstinence. Social prescribers now in general practice are really useful. We're really able to link in with them, because what they know is where the patient lives, where their GP is. They know all the other services out there that can help with debt, that can help with community support. Because what happens when someone tries to stop gambling, they've suddenly got lots of time and they've lost their friends, they've lost their family, they've lost their job, they've got no activities or hobbies left. So again, we put people into art therapy, walking groups, singing groups, anything that the social prescriber can find. So it's medical, like a behavioural addiction, so CBT and psychotherapy, but it's also the love that has to be there as well, I think, with this group.
So if a GP identifies a patient that has got a problem with gambling, and is there anything that they should be doing in the practice alongside obviously trying to get them the specialist help they need?
Yeah, so all we are asking in the NICE guidelines or in some of the educational work that I've done is that you ask the question. We call it very brief advice, and that is you ask, you advise, and then you act. So for instance, asking would just be asking the question, are you worried that you gamble too much or that someone close to you does? So that's the ask bit, and that's the first bit. And then, like you say, you need the knowledge behind that to go, oh, what do I do if someone says yes? And so that's where we want to educate the workforce so that GP can go, that's fine. Okay, I hear you. I know where the services are that I can get you support and I can get you help. They really don't need to do any more than that. It's just identify and then have the knowledge of the providers in their region that they can send people on to. And also in this area, which is really important for patients, is just to stress that this is free help and it's confidential, so that we really keep people in the system and then they don't get lost. And then ACT is actually doing that, but also linking them in, as I said, with the GP social prescriber for all that other holistic help. It might be homelessness, finance. Often we have to give food bank advice and food tokens. All of that can also be done. And that's the acting bit. So there's lots that can be done. Yeah, if someone says, yes, actually, I'm struggling.
You've been involved in developing an educational resource for primary care staff that's a partnership between the RCGP and the charity Gamble Aware. Can you tell us a bit about what that resource covers and how it can help GPs and practice teams?
So this started back in 2019 when we first started the whole programme of let's start a treatment service led by primary care and let's do an awareness promoting campaign. And so over the last year, I've worked with the Royal College of General Practitioners to bring this all together, to formalise it so that actually we can start really raising awareness, especially when the NICE guideline comes out. So we started with a competency framework for primary care, which really looked at the knowledge, the skills, and the attitude. So, being non-judgmental, being confidential, listening skills that are needed in this group of patients. It consists of 7 competencies, and they range from competency 1 being one that you could use in the whole practice, whether you're the receptionist, the nurse, the physio, the pharmacist, someone that works in the office. And it's just talking about gambling. Why is gambling happening? So for instance, even the National Lottery, we have a lot of people that when you ask the first question, how did you start gambling? They will say, I bought a National Lottery ticket online and then I got sidetracked with the games that are there. So I started playing online Monopoly, which was on the National Lottery website. So it's just talking, trying to reduce the stigma. And that could be a practice-based learning. Just competency 1, it's for everyone. And then as we go up, it gets a bit more in depth. And so it would be a healthcare worker being more responsive. So doing the ACT, advise and asking the question. Or it can be someone like me, who's a GP with special interests. So you get involved with more detailed assessment. You're looking at risk for this patient. You're looking at a package of care. And then you're looking about how we provide treatment and support in the community that you work in. It goes from competency 1 to competency 7. So we did that, formalised that. So that's now on the Royal College website. And out of that, we then went on to do some e-learning modules so that we could educate the workforce. So there's 4 e-learning modules. They're 30 minutes each. I've written them, and I was really keen that they stay quite short and snappy. There's one on introduction to gambling, which is just really interesting. It's about understanding the industry, understanding the regulation at the moment, and what gambling harm and stigma is. The next one is about identification, so that people know when to ask, as we've mentioned, which populations. The third is about treatment. And then the fourth one is a kind of walkthrough of a GP with a patient, a real life kind of scenario, so that you can mirror that when you're in a consultation with a patient that says, yes, I need help.
Practices can also become an accredited gambling harms practice. What does that involve?
So I think I've touched on this in the sense that our main aim here is to get patients into treatment. And at the moment, patients don't know that they can come to the NHS. They don't know they can come to their GP. So I was really keen that after the e-learning, that the people that had done it could then become, if you like, champions within their practice or within their primary care network to share that learning, maybe on a lunchtime learning or something like that. And so we developed a gambling harms pack for those that have done the e-learning, which they could then take back and champion in their own practice, with the most important thing being that they could put a poster up in their waiting room or patient-facing spaces in their practices to say, look, speak to us, speak to someone in this practice if you're experiencing gambling harm, because we can help you. Because again, if the patient doesn't know that we can help, and we don't have the knowledge to help, then we're not going to get anyone into treatment. And there's loads of treatment out there.
What sort of key bit of advice would you give to GPs and other primary care staff about gambling and gambling harms, given everything we've just talked about today already?
Yeah, so I think to really start thinking about it in your consultations, especially when you're asking in mental health consultations about alcohol and maybe recreational drug use. Also just think about gambling, even if you do it in that group of people and patients who are on Parkinson's drugs, you are making a difference. You are going to identify individuals. We really need to be identifying, as I said, to get people into treatment. So just to say, it's not arduous, just ask the question and then signpost on. And then there are plenty of support services and treatment services out there that are specialised and will do the rest for you.
Is there a concern that we don't have enough provision to deal with these people if more of them are identified? Or is that something that we just need to do anyway, and then the NHS will need to develop more treatments once we know the scale of the problem?
Yes, it is difficult to know the scale. So it is quite hard to plan your workforce and what provision is needed. So for people who are listening to this, currently there is a voluntary levy on the gambling industry who donate an amount they choose each year to provide support to pay for services for treatment in this area. The white paper that came out in March 2023 had a number of recommendations, and the most important recommendation it had was that the industry should pay a 1% mandatory levy. And what that means is now we're going to have, hopefully, a bigger pot of money that is sustainable and can be used for treatment, education and research in the area. Everything will be more planned and can be adapted and more agile to increase demand, because that's where we need to be really. And having a mandatory levy is the best thing that came out for the white paper, because it means we can have a sustainable future.
Is that money going towards voluntary providers, or does any of that come into the NHS as well?
So we're currently working under the 2005 Gambling Act. And so up until the last 3 years, all gambling treatment and support was provided by this voluntary levy funding. Quite controversial because it is kind of like the polluter pays, and some people think the industry shouldn't be running the treatment service, which I totally understand. But that is how it's paid for at the moment under the 2005 Gambling Act. So that's the system we are working within. 3 years ago, what happened is that the NHS did find a pot of money to provide care for the NHS secondary clinics. So there is now probably 90% of care being funded by voluntary levy funding and about 10% being done in the NHS.
Do you think there needs to be bigger curbs on advertising and things around gambling? Because it's so easy for people to get access to this stuff now. I mean, it's everywhere.
That is one of the criticisms of the white paper recommendations, that they haven't done enough to clamp down on advertising. Because if you watch TV, if you walk down the road, you look at the tube, you can see that it's there and you can't get away from it. It's everywhere. And so, yeah, you're absolutely right. That has been the main criticism, that they haven't made recommendations strong enough for that.
Well, that's great. Thank you so much, Emma. Thank you.
Oh, you're welcome. Thank you for having me.
Well, that's it for this week. Thanks so much for listening, and thanks to Emma. I'll be back next week for our regular news review, so please do join me then. If you're enjoying the podcast, please do think about giving us a rating or leaving a review. It really does help us out. And don't forget, you can keep up to date with all the latest news affecting general practice and access a host of other resources on our website at GPonline.com.